We're here today at the SEEK National Workers' Comp and Occupational Medicine Conference with Dr. Ronald Fairbaugh, a well-known chiropractic physician who practices in Columbus, Ohio. Doctor, how can chiropractic guidelines be used to reduce costs and achieve early return to work?
Okay, Steve, that's a great question. Basically, by understanding the guidelines that exist in chiropractic, it helps the person doing case management to understand what normal or average is. And if you understand what normal or average is, it's really easy to identify the outliers. And then if you focus your resources not on micromanaging every case, but really focusing on the outliers, it helps greatly reduce costs in the system for management, for medical legal expenses, and it really helps also focus on return to work, because you can focus on those outlying cases. And just because they're outlined doesn't necessarily mean they're fraudulent or bad or deceptive. They're just out of the norm. And there are many reasons why some cases go out of the norm. But by focusing on those cases, it helps you laser in on which cases need micromanagement, which cases you need to interact as the case manager or physician reviewer to work with that doctor to get that patient back to work earlier.
So what are some of the chiropractic best practices that should be used?
Chiropractic best practices, first off, we have to understand the word what best practice means. Best practice is a union of three. It's like three legs of a stool. There's research, there's clinical decision making, and there's patient values. People like to focus on the research and double-blind studies, and if there's not research for it, sometimes they don't like to allow care. But the reality is, in a best practice world, in real-life clinical treatment, in a real-life clinical setting, a physician has to take into account all three things: research, clinical decision-making, and patient values. And by doing that, it helps them basically make better, rational, evidence-based clinical decisions. And the clinical decisions in chiropractic, the basic benchmarks, are that first 2 weeks of care. After the first 2 weeks, we don't expect somebody to be 100% well if they've had a major significant injury, but we do expect improvement. So that first benchmark comes in 2 weeks, and you're simply measuring, is there some kind of improvement? If there's improvement, you treat for another 2 weeks for a total up to 12 visits, followed by the next benchmark, which is a full-blown re-examination. And it comes back to also a philosophy of practice, really. In a best practice world, the best doctors are those that only accept those patients they believe they can really help. And then followed by another principle, which is give a patient what they need, nothing more, nothing less, always. And if you practice that way, you're understanding guidelines, but you also understand the uniqueness of each patient, and you're understanding patient values, then you wind up in a best practice world with costs or care that basically produces a better outcome in a shorter period of time with less cost. And that's what our society needs.
Last question, Doctor. How can chiropractic care help achieve early and safe return to work?
That's another great question. The best chiropractors, in my opinion, are those that once they get an injured worker in, pick up the phone, call the employer, human resources person, case manager, somebody, to find out, one, are there any light-duty jobs available? What are the barriers to return to work? If that dialogue doesn't happen, and the chiropractor or any other physician for that matter just treats, they're missing out on a vital component that can assist that patient getting back to work much earlier in the case. So focusing also on early function. In other words, don't just treat passively, but as soon as the case permits, getting that patient active and moving. These days it's all about function. So the quicker you can get a patient back to work, or back to normal activity, the faster you're going to return them to work. So in this environment today, the best doctors are those that understand that no doctor does it all. Sometimes it takes a multimodal, multidisciplinary approach to treatment. And secondly, you're getting the patient involved. And that means patient education, advice to return to work despite the presence of pain. Pain's not always a barrier to return to work. If we wait for pain to be totally gone, patients take way longer to get back to work than realistically is required. And early effective treatment that includes a combination of active and passive modalities with a dwindling amount of passive modalities as the patient improves.
Thank you very much, Doctor.